This is Andy Bopp. I'm a member of AOTA's healthcare lobbying team, and I'm doing this video to help you with lobbying for the SMART Act, which is legislation that addresses the 15% cut to OTA reimbursements in Medicare. By way of background, and this really isn't critical to bring up in your meetings, but this policy came about in 2018 as part of the Bipartisan Budget Act, which did many things, including repealing the therapy cap, which is a very good thing. Unfortunately, this was included in there, obviously a bad thing. What it affects is Medicare Part B services that are provided by OTAs or PTAs. This is a policy that hits OT and PT, really specifically those two. And what it means is that a service provided by an OTA is paid at 85% in Medicare as if the same service were provided by an OT. The same applies for PTAs and PTs. CMS began monitoring this by applying a modifier in 2020, and this policy went into place in 2022, this year, which means it is in place right now. This came about really because key congressional staff wanted it, right? Key committee staff have really looked for this policy for quite some time. It is similar to, but not the same as, but similar to how PAs and nurse practitioners are reimbursed at 85% for codes, as opposed to what a physician would be reimbursed if they did the same service. It had been something AOTA had successfully fended off in the past, but this time was not able to. We were able to work with APTA and others, though, to minimize the impact to the extent possible with CMS based on, minutes and looking at different ways this is implemented. Again, this is background. You really don't need to know this for your meetings. The bill, which you'll be supporting in the House, is the SMART Act, introduced last year in 2021. By Bobby Rush, who's a Democrat from Illinois, and Jason Smith, a Republican from Missouri. Bobby Rush represents a district in Chicago. Jason Smith represents probably one of the more rural districts in the country, southeastern Missouri, a rather large district. Both of these two are amazing champions of OT. You go through the list of different things they've led on. These are two of our greatest champions. There are 38 additional co-sponsors of the bill, which is what you'll be asking your representative to do if they're not already a member. I'll refer to this again, but you're going to want to check before your meeting whether they are a co-sponsor or not. You can check at congress.gov, enter the bill number, HR 5536. That'll give you a list of the co-sponsors. A meeting, you're going to want to say thank you to a co-sponsor if that is your representative and that's who you're meeting. So what does this bill do? Three things, two of which are the key things you're really going to be talking about during your meeting. One, it would exempt this 15% cut from medically underserved and rural areas. There's a lot of reasons for this. We'll go into that later, but that's the number one provision. Two, it would standardize supervision requirements in Medicare. Right now, for Medicare, private practice direct supervision is required as opposed to general supervision, and this is OTs supervising OTAs. Whereas general supervision is required in all settings in 49 states. The one where it is not is Kentucky, interestingly. The third part of the bill was to delay. The bill's already in effect, so that when this bill was drafted, that was to attempt to delay it for this year. That's part of the bill, but that likely is not something that's going to happen. When you conduct your meetings, especially for the rural provision, you're going to find no one who is questioning whether rural residents have healthcare access issues. Telehealth is one of the ways that's looked at, but that is not something that's questioned. It is certainly also an issue in therapy, as you all know. Any of you who practice in rural areas know it's a big issue where OTAs provide a lot more of the service, and there's just fewer practitioners in general, period. So you don't have to do anything memorizing this chart or anything, but just know that when you're in your meeting, you're almost certainly not going to be challenged when you state that as a fact. The same conditions apply to medically underserved areas, which may not be rural, Generally, they're going to be lower income areas and such. And again, the same access issues are there across healthcare, and specifically also in therapy, and of course in occupational therapy. And in these areas, OTAs often provide more of the services and more of a backbone of what's provided. Okay, so for your meetings, you're going to want to start out really making sure the person you meet with is familiar with OT and OTs and how they work together. This will not probably be the first issue you discuss, so they should be familiar with OTs. Make sure they know how the OTA team works. Staffers may already know that. You may have a staffer who says, oh, my cousin's an OTA. In that case, just move on from that. You know, if someone, don't explain things that are already known, and as part of everything, you know, have a conversation with the staffer. When you discuss the provisions, emphasize that these rural and underserved patients rely much more heavily on OTAs. That is why this bill targets those areas and not just everyone in general. So it's specifically looking to address really an unintended consequence, and that's why you're focusing on that. For supervision, note that Medicare allows general supervision of OTAs in all other settings, right, except for private practice where it requires direct supervision. Note, really importantly, that 49 states allow this general supervision of OT. Kentucky is the one that doesn't. If you're in a meeting with the Kentucky rep, you could point that out. But in these 49 states, you know, general supervision is adequate. So when you have these unnecessary supervision requirements and you're cutting by 15%, you know, you're making it very difficult, especially for smaller private practices, really, that may only have a few OTs, very limited number, and a few OTAs. So that this is a burden that could easily be remedied. A key that you're going to bring up, you know, nothing exists in a vacuum. So these OTA reimbursement cuts were created in 2018, before COVID, before inflation, before the physician fee schedule cuts and everything else set in. So these cuts are not instead of the physician fee schedule cuts for OTAs, they are on top of. So physician fee schedule cuts cover all OT reimbursement, and wherever that lands is where OTA then takes another 15% hit. On top of which, of course, you have inflation, which, 4 years ago didn't even exist to any great consequence. So it is really a bad time for this to be happening, and it is really having an impact in these areas like we've mentioned. You're coming to Congress because Congress is the one that put this into place. CMS did not put this into place, so Congress is well positioned to deal with the unintended consequences in rural areas and these private practices. You're going to want to emphasize which beneficiaries are most at risk. If the representative you're meeting with represents a rural area, obviously point that out. If it's a medically underserved area or a lower income area, obviously point that out. They will know who they represent. You don't have to go in there and analyze, but these representatives will care more about this. As in all lobbying, if you're an OTA, if you work with OTAs, if you're in private practice, any of these things, if you are involved with this issue directly, state how it impacts you, state where you work, what town in the district, you know, what clinic, what setting, what you're doing. That always brings it home to the rep and the staffer you're meeting with. For your House meeting, you're asking for co-sponsorship. You know, and like I said before, you're going to want to, before your meeting, go online and check to see if they are an existing co-sponsor. It's listed on our website, but it's also here at congress.gov. You enter HR 5536. If they are a co-sponsor, you say you're going to talk about the other issues, physician fee schedule and other, but you're going to want to say, really, thank you for doing this. When you do that, you're obviously then not going to run through the whole bill and describe the situations and everything, because they already support us. So there's no reason to, that would be using the phrase preaching to the choir. There would be no need to do that. For your Senate meeting, you're going to ask for support when and hopefully while the physician fee schedule issue is addressed, which would, if any, you know, passed is the forecaster would be in December. So this would naturally fit in with that. It's all Medicare reimbursement. You know, there's a lot of reasons why therapy should be pushed aside from that entire cut situation. This is a logical area where that could happen. Mention the House bill, that it has these co-sponsors, and there is a Senate bill in the works. So we fully believe that the greatest chance for this bill would be, again, likely in December, likely when fee schedule is being addressed, which you have already talked about. So that's where this issue is. It's a really good one, and I wish you luck as you lobby for it. Thank you very much.